Good. Hey, how are you guys doing? Hope my job today is to make this fun, exciting, hopefully. That's the overall plan. You guys have a long day. Let's get started quickly. My job today is to kind of entertain you if possible. As you guys already know, you guys have been practicing for long enough to have some good stories, right? We all do, right? Right. Great. I like your building too, by the way. I always drive by it. That's fantastic. And one thing that I do have my cards in the back. I have a podcast. I have all social media stuff. So if you ever want to be on my podcast, let me know. As a chiropractor or something else too. Also too, on the last talk I did in Orange County, one of the doctors had mentioned one of his buddies is a chiropractor in Orange County too, has a great book called Heal the Nation. Basically, it's a great book about intro for patients for chiropractic. Also lifestyle changes too. So if you want to look at this, you can. I'll put this up here, over here if you want to. It allows people to really understand, as for me, and I'm a slow reader, so I'm on page like 75, 80, had it for 2 weeks now. It's something to where I think as practitioners, sometimes you forget, because we're in with patients all the time, what are patients thinking about chiropractic? Who are we from their perception? What do we actually do? So it kind of breaks it down, the philosophy of chiropractic, yes, from 1895, B.J. Palmer, D.D. Palmer, all those guys too, but also gives you the updated version of how are people thinking about what we do and how do we communicate that to our patients so we're on the same page, right? Okay? When someone comes in your office, as you guys know, looking for what is the adjustment, how does that work? I have people come in all the time, doc, where they come in, this is 2024 now, they still don't know what the adjustment is, how it works. They've never been adjusted before. They've never seen a chiropractor before. It amazes me how some people have never seen a chiropractor before, as you guys probably do too, in the sense where the adjustment is phenomenal when you get them on the table. And can you get them on the table long enough, often enough, so at that point you can help them feel better and then stay better. A lot of said patients come in the door, they do the one-time visit, they come in, they leave. In the sense where they get their adjustment, first adjustment, they never come back. Sometimes it's their affordability. Sometimes they just didn't get the message properly. Sometimes it's the wrong place for them too, right? How many people come into your office, in your head, all of a sudden, all these red flags come in. Like they have heart issues, high blood pressure. They may have even had a fracture. So you go, are they in the right place? I've referred probably, my 20 years of practice, probably close to 10 patients out for an MRI right away. Out to the ER right away. I had a patient, he was a mechanic, younger guy in his mid-20s, and he actually came in after 4 days of back pain, had not gone to the bathroom in 4 days. What does that mean, right? He has a pinched nerve and probably a herniated disc or a screws disc to his lower back, causing his bladder to contract so much he can't urinate. So right to San Antonio Hospital down the street from me. At that point, had the MRI that day. His girlfriend called me later on. He's having surgery that night. So can you catch things before the adjustment to make sure you're doing the right thing for your patients? As Ron had mentioned too, how do you avoid getting sued, right? That's a big thing for people. I have a buddy of mine, he works for pediatrics, a big network, and he deals with their problems in the sense where someone complains to them about their doctor, their pediatric doctor for their kid, older kid, young kid, whatever it is too. Very sensitive topic. What he says and tells me, when I play golf with him once on a blue moon, a lot of it is, can you communicate with your patients well enough so you don't see that there is a problem? I'm putting my hand here. I'm putting my here for this. Does this feel okay? Is this okay to you? Is this comfortable for you? Does that feel uncomfortable for you? I'm going to do a little bit of move here. Let's see how this feels first before I do the full adjustment. So part of Dr. Trugo mentions too is the power of the piezoform. Your hands are very important. But before that, is your communication proper? So at that point, as you guys already have this down, your patient understands they're comfortable, their situation, they're not surprised by the adjustment. What do they expect, right? So adjust someone's neck. Is it going to be loud for the first time or not loud? What do you tell your patients? What do you think, Doc? Doesn't matter, right? Okay. And sometimes it's so close to the ear, at that point, will it be sometimes, I give them in anything, do you give them a high expectation, like it's going to be really loud? Sometimes but it may not for you. Let's see how it goes. So I give them worst case scenario, right? So at that point, they're not surprised by it. Like, we got to make sure it's going to feel okay, but sometimes it may not be exactly what you're expecting. So you give them a broad range so they're not going, that didn't happen the way it's supposed to happen. So can you leave them after their first adjustment away, and as you walk through that, maybe you take extras in the office, maybe you don't, maybe do a full exam, maybe you don't, but you want to make sure you have enough information for you to make it safe for you, that point first of all, then safe for the adjustment, correct? Is that what we're looking for? That's what we want to do for our patients. I think a lot of when doctors don't do that perspective, I get some patients in my office that have been in other chiropractors in the area or sometimes outside the area where they came from, and they don't feel like, they come in sometimes upset. I go, ugh, what's it? And the staff will tell me, can you talk to this new patient? I'm like, I'd love to talk to someone who's angry already, coming in the door. I love it. So I always find out, what did the doctor not do properly, because we're all different, right? That they may have missed that allowed this patient to feel upset leaving that doctor. And a lot is communication. They didn't tell them enough stuff up front that it might hurt a little bit afterwards. You might be sore afterwards. It may not be a cure-all from one visit, right? Boom, it's not magic. If you had a problem you guys know this, if you had a problem for 5 years, your back pain, and also you come in for that magical adjustment, does that pain go away in one visit? Sometimes, a very small percentage, but you've had now scar tissue around that area, you built up adhesions, muscles shortened, your lifestyle's changed. How do you get that person to understand up front, hey, look, you've had it for a long time. I'm going to help you, but it may take you weeks, even months to feel like it is better, right? Okay? We all do the pain scale thing, right? 1 to 10, where are you? I'm a 10. But I have a wedding in 3 days. I want to be able to walk down the aisle. I'm like, good luck. Let's see what we can do. We want to help them, but sometimes we have to give expectations that are realistic, not just in their mindset what their expectation actually might be. So when we have the situations overall, as you guys had too, if you take extras in your office, for one, that's what I do in my office. I'm up here in Upland. So at that point, I can show them evidence what's going on, the examination, leg thing check also, as you guys probably do too. At that point, it allows them some idea that we're real doctors, right? How many doctors do you know, or been practicing for a long time too, where you had patients walk in the door and go, okay, lie down. They go, for what? This isn't a massage today. So we want to make sure we're giving information as doctors, as we have been. This is why we're going to do the adjustment. This is why this adjustment is going to help you. This is why you're here. Okay? I want to make sure my patients understand they're in the right place, as you guys do also. And we're in the right place. Do you want people to come in for one adjustment? I don't. I want to come back multiple times if need be, and over time make it, as Doc does, make it their lifestyle, part of their lifestyle, so they know once I'm healthy, when I'm feeling this, I know I got to go back to see the chiropractor. That's my first line of defense when I have hand tingling, when I have headaches again, when I wake up and I don't feel like my body's loose and relaxed. So you want to make sure over time, as you guys already do, can this adjustment allow them the benefit in that link of, if I get adjusted, I feel better. In general, right? If I get adjusted, but specifically, if I get adjusted, my neuropathy goes away. If I get adjusted, I sleep better. If I get adjusted, as you guys know, over time, when someone has chronic pain, what happens to their mentality, their psychology? They feel happy all the time? Or does it affect them in their head to where now they sometimes feel stressed, sometimes feel anxious, sometimes feel depressed? How many have you had patients like that? I have. And when someone's in chronic pain, I always ask them in an initial exam, how do you sleep? We all know this. Why is sleep so important as a diagnostic tool to understand where they are in that assessment? When someone's not sleeping well, how does their autonomic system fire? Does it stay more rest and relaxed? Or does it get more stressed toward that fight or flight? We all know this. So can we verbalize to the patient what they're feeling is their nervous system? What's going on in their body is nervous system. Their lack of ability to do their daily activities is their nervous system problem. So when we have that, allows them to link, what is it? I'm in the right place. This doctor's going to help me. And sometimes, and you guys understand, sometimes someone comes in, like we talked about earlier, having red flags. You go, let's do the MRI. Seems like that leg atrophy, you're dragging your foot, that foot drop may not be normal. You've had it for a long time. So I may still treat them, but let's make sure we set up an appointment for something else down the line if need be. Okay? I give my patients just my rule of thumb, 2 weeks to get better, to feel better, to see improvement. If not, out for an MRI, out to ortho, out to neuro. I want to make sure they're in the right place. Because we're a specialty, correct? If you're outside our specialty, what are we really doing with our patients? And it's not going to be a lawsuit, for example, but we want to make sure we're being ethical and right with this patient because they're for your care. So going back to when you do the examination, as you guys already know too, can we communicate well with our patients? That communication allows them to understand that they're in the right place. At that point, that autonomic system, if they can't sleep well, and that I always ask them, do you feel overstressed sometimes now you've had the pain? And if they go, yeah, I do a little bit. Do you feel sometimes anxious? And they ask me, what's anxious? I'll go, you just don't, when something that, say 2 months ago didn't affect you, now you feel your body kind of tighten up. You don't sleep well. Your overall body feels like you wake up and you're just not recharged. You don't get that deep sleep anymore. And they go, yeah. Then I go, do you feel sometimes depressed? Where now you just don't want to do anything. When you do stuff, it's like you don't have that umph anymore. And if they go, yeah, okay, let's link that back to your nervous system because now your nervous system is being blocked. Then this adjustment again will help release that. So over time, I'm going to ask you, I'm going to prioritize not your back pain, not your sciatica, not your headaches or your neck pain or neuropathy down the fingers, but I'm going to prioritize, are you sleeping better? So when I see you next visit, I want to know, first of all, are you sleeping better? Because if you're sleeping better, then your body can relax. So now your pain you're having, your symptoms, your neuropathy can start going away. Does that make sense? Does that kind of like give you a way to, and you guys might do this already too, that's how I verbalize to the patients. I get the expectation of it's going to take time to heal this, your neuropathy, your pain, but also we want to make sure your overall nervous system is getting better. Now, doc does a great job with that in the sense where you want to make sure you give them the big picture along with linking that with the small picture of their symptoms. Because what do people come in for your office for? What's the number one thing people come in your office for? Do they want to sleep better? Maybe. Do you want to have a healthier lifestyle, get stronger? Maybe, because they're in pain, right? That's the number one thing most guys. And we want to get away from that. We do long term, but they're in pain. They want to feel better. They want to get better. They have neuropathy. They want to get better. So can we give them the link of that neuropathy, that pain back to the nervous system over time so they feel that they're in the right place again? How much is communication part of your office? What is that? How does that work for you? Do you guys use that as a way to really connect with a patient? How many people here see senior patients, say someone over 55, over 65? Anyone see senior patients? I do all the time. Okay. A lot of them, when they come to me, especially if I see them a couple of visits, they'll tell me, went to my doctor didn't give me the time of day, didn't listen to me. They didn't sit down and really listen to me. What is that? How do you translate that? You didn't have to do this for 10 minutes and listen to the whole life story, but they didn't sit there, they didn't actually communicate they want to communicate, correct? There's that old thing that's called like attracts like. You guys know what that is? If someone sits like this, you sit like this also. Someone talks at a high volume, you talk to a closer volume as them. Someone talks at a slower speed, you talk like that too. That connection, that initial visit, that initial connection, subconsciously tells them, hey, they're like me. At that point, they can give you a little bit of opening to give you some trust. But you're sitting there on an iPad going, okay, here's your problem here, here's this, this, and this, like sometimes typically MDs will do. At that point, here's your medication, I'll see you in 3 weeks. It took them 3 weeks to get the first appointment. They're like, this doctor has no idea what he's doing. They haven't built that trust yet, as we have to sometimes, because you're seeing chiropractic for the first time. I think that's important for us to kind of realize that first visit may take a little bit longer than normal, but you're building that trust so long term they can come back and see you. I had a patient come in, Charlie, he's been a patient from my office since probably 30 years ago. I'm the 5th doctor in there. Everyone else passed away. I'm kidding, they didn't pass away. They retired. But a lot of it is when they're doing this, is they come back because they know the office, they know the staff, they expect that personal touch. We call it personal and professional at the same time. At that point, you give them that extra little what they're looking for because you know their name, right? Okay. When someone walks in your office for a second, third, fourth time, do you want to make sure you know their first name? You want to make sure? Make sure your staff does also. What is the most important word that everyone wants to hear? This is old school, I think, not theology, but what's it called? What's his name? I forget his name. Old books type stuff. Think and Grow Rich type of stuff. What's someone want to hear when they in a crowd or when they go somewhere? Say in general, what do they want to hear? What's their thing? Their name, exactly. Okay. When you know, hey hi Sally, how's Mary? Hi Nancy, how's your kids? When you remember something a little about them, their name, and one more thing, they go, man, this doctor really knows me. They ask me, how did you know my son went to blah blah? Because you told me 3 weeks ago. When you can do it, write it down, or just I have a file in my head, I don't know how to get it. I can remember that. My wife will tell me to pick up milk on the way home. I don't remember that at all. I don't know why. It's a filter. Maybe it's what it is. But it allows you the ability to have that connection with them, that connection, so at that point they know they're there to help you. You're not doing something else in your head. You're there with them. Because you get so many stories, especially seniors, because they're the doctor sometimes so often. Doctor listened to me, gave me the wrong medication, didn't help me. I had a patient now that's come back on Monday. I was here a couple weeks. She had some issues, medical issues, and she was telling me about, and this doctor did this, and I had to file a complaint with this doctor. So we have to make sure we're connecting with our patients as much as possible, as you guys already do, to make sure that we're getting our message across to help them initially with their pain neuropathy, but again, long term, keeping them healthy. I have a patient, Nancy, who's been in my practice for probably close to 12, 13 years or so, retired. She does really well. I go, I can see you less. She's like, no, I like coming in. I want to come and see you. She has this pain. She always has something going on, which is fine, but it's something getting someone better and healthy. They trust you as their healthcare practitioner. Some people have that. They want to come pick your brain about their health issues, not their MD, not anyone else too. They want to make sure you understand what they're going through right now in their health history, even if it's just for information. Does this seem right to you, doc? I go, sometimes I go, I don't know what that is. We look it up for you. Find out. We get back to you. So when you have that trust factor, I think, especially with the adjustment too, allows you to really understand that you have patients that you may have for life sometimes, as doc does, that allows you to really, if you want to call it, even pick their brain, hey, what else can I do? What else can I help you with? At that point, that helps you with the next patient, next patient, next patient. Who wants to grow their practice? I do. I want to see more people all the time. Okay. My Mondays I call them emergency Mondays. We get probably 3 or 4 new patients every Monday, just from people calling because they hurt themselves over the weekend. They're my first opportunity to get them to understand chiropractic. So I want to make sure my Mondays, I'm clear-headed, I'm ready to go. My staff is too, because we know those calls are coming in. It's going to happen. Mondays are like just sometimes emergency room Mondays or urgent care Mondays. So we have that mentality. It's going to happen. Let's be ready for it. That way we don't come in Monday dragging, right? Okay, Monday is my start of the week. We probably see close to 70, 80 patients on that Monday. We want to make sure we're going the whole time. Our normal patients we see, our urgent care patients for once we call them, x-rays are done that same day if need be, boom, ready to go. So when you have that system ready in play, there's not a lot of downtime. Who's impatient like me? I am. I ever go to a restaurant, what happens? I see open tables, no one's sitting there, people in the waiting room or in the restroom waiting to be seated, and the waiters are sitting around like, tell my wife, let's go, going somewhere else, we're done. If this is the start of us sitting here waiting to get seated in these open tables, we're going to be sitting here for a long time eating our food and then getting out of here 2 hours later. Let's go. So I want to make sure when you have a system in play, again, this is going back beyond the adjustment, is your first impression when you walk in the office, hi, we saw you called. At that point, Sally, grab a seat. Here's some paperwork for you. We'll be with you right away. Boom. At that point, people are coming in and out of the office. That person's taken care of within 15, 20 minutes. They're x-rayed if need be, treated, and they're out in 45 minutes to an hour. So you have enough time with them, but not too much time to give them what they need at that point and get them out and get them home, ice, whatever they need to do at home, or heat, whatever it might be. Does that make sense? I don't want to wait for I don't want myself, give my patients the same courtesy, respect, their time is valuable too. How many times you go to see a doctor, or a family member does too, if you have kids especially, you sit there, you check in and go, okay, we'll get to you in about an hour. I'm like, what the heck? My daughter had knee surgery. She had to see the ortho, I think once a month or so, for after surgery. And I asked him, why is it so long? Because the doctor's so good, he's so busy. I'm like, no, you just can't schedule him right. So can we make sure our appointments aren't like that? In the sense where, if we want to get them on the table, do you want them mad, or do you want them, okay, this makes sense. I've been here, I've had a fast process, get you adjusted, get you guys going. Who here practices solo practice? Good deal. Anyone else solo practice? Good. So at that point, if you want to, let me know. In about probably 15 minutes, so we're going to start adjusting. If you guys want an adjustment, you guys can. At that point, when you're in solo practice, what happens? You don't have the time to go down the street to get adjusted. None of us do. I work with a partner, phenomenal. I've been a partner for since I started in this practice about 22 years ago. It's been fun. If you don't have a partner, at that point, sometimes you miss the adjustment. When I did my seminar a month ago in Orange County, I had like 3 people. I've been adjusted for probably 5 years. So get your adjustments if you can. Again, walk the walk so you understand, as you guys already do, how important it is. Sometimes my patients will ask me, how often do you get adjusted? I go once a week. I go, why? Do you have any problems? No. Feels good. I want to stay healthy. When we can walk the walk, at that point our bodies and our patients give us that, okay, they get it done too. How many people here work out? Even just walking, some stretching work, things like that too. Why is working out so important? Or staying healthy, I guess you want to call it that. Okay? We have to push people around all day. Okay? Unless you have a passive type of adjustment, pushing around people all day long works on your body. I worked with a chiropractor as an associate when he came out of school. He had to have hip surgery. He also rode a lot of horses, worked on oil rigs too, so that combination of lifestyle, it led to that. I worked with a doctor who had to have a TENS unit put in his lower back. I forget what it's called exactly, but inside his back, because his back was hurt so bad from playing football, other injuries too, but just because of all the work we do here. A buddy of mine, he's had wrist surgery, elbow surgery. He's going in for knee surgery too. So can we take care of our own body as much as possible, do this for a long, long time? Okay, I'm 50 years old this year. Got my AARP card. Yay, fun. Okay, got that in the mail, right? Where it says, an envelope says, welcome to your 50s. Here's your card. I'm like, thanks, appreciate it. Thanks. Yay. So I want to make sure I can practice another 15, 20 years and stay healthy. How many people here see labor workers, like union workers, iron workers, UPS workers, all those things too? They get beat up sometimes. I always tell them, get your treatment, do your stretches, do your exercise, or if not, they'll just wheel you out when you retire. Just wheel you out to your car. That's it. And I always think, after a certain age, what point do people feel invincible? I'm sorry, not invincible anymore. When we're 15, when we're in our teens and 20s, we all go, I'm going to live forever. I'm going to have some pains here, but I'll live forever. Once you get to a certain point, I always ask my younger patients too, is I always ask them, if you have an injury coming in for an injury, UPS employee or iron worker or something like that too, is do you still feel invincible? If they go, yeah, I do, I'm like, don't worry about stretching or icing, you'll be fine. Do your skiing or whatever you want to do, have fun. Once you get to the point that not invincible, at that point, do you have an opportunity then to help them learn to take care of their body? Is that your opportunity? But if they're not going to listen to you, for me, practice 20 years plus, I'm not going to waste my time. I don't like to give someone advice. They're not going to want to actually use it. So I go, yeah, go live your crazy lifestyle. Keep drinking Red Bulls every morning, one for lunch, one for dinner. Have fun, whatever you want to do. Let me know when you're ready to learn something. So a lot of it has been practiced long enough too, Doc, is when you get to a certain point, you go, let's not waste time with someone that's not looking for that. They want the adjustment, that's fine, but I'm not going to help them their lifestyle if they're not going to actually listen, because I have other people in the rooms that are ready to go. Let's focus on the people that actually can help. All right, any questions about that? Or so far? Anything? Any docs want to get adjustments? Good, come on up. So quick, we'll do a patient scenario. I'll do my patients. Okay, I'll get started early because sometimes I forget. Yes, perfect. So Doc, Tony, how are you?
Steve.
Steve, nice to meet you. Steve, grab a seat. So Steve, I'm going to walk you through what I do with my interns also. I have interns in my office. I work with the Baldyville ROP down here in Ontario. also Upland High School, 2 down the street from me. I always walk them through a scenario so they see it too. So Steve, correct? Steve. So Steve, what's going on today? Just in general.
Neck's a little bit off.
Cool. And then how long have you been practicing, sir?
20 years.
Fantastic. You look young, my friend. Good genetics. Where do you practice?
Irvine.
Great. Well, a little drive for you. You see, you didn't hit traffic though.
Traffic was good.
Traffic's good. You take the 10 freeway or the 60? Yeah, you've never been out this way before.
Maps.
Like Ontario Airport, I'll be near there. That's all I'm hoping for. Yeah. It's funny. This area is there. It's getting there, but it's obviously it's not those areas out there. Yeah. So a lot of it is when you practice. What technique do you usually use?
Diversify.
Me too. And someone called something about a really technique I've heard a long time ago. I do that. Let me look it up on Google. You see what it is. So when you sometimes, as you know, Doc, people come in, especially if they've seen chiropractic for a long time, they want a certain technique, right? You get that? Certain technique, and they go, okay, I don't do exactly that, but I can give you this, this, and this. So can you kind of convert them? I want to say convert them, not religion, but a technique's great. But this is what the technique really is. I'll do my technique that converts to something like that, and give them an opportunity to experience. They don't need just the palmar adjustment, just this adjustment. They want to make sure you give them the idea of I can help you overall. In your office, do you take x-rays, exam, all that stuff too? Yeah. Good. Do you help your patients with exercise afterwards also? Good. And right now, what's going on with the neck? Is it just tight, sore?
Yeah, headache yesterday.
Do you do a lot of working out too?
Yeah, a few times a week.
Good. Do you work more upper body, also lower body?
Both.
Fantastic. Headache, where do you get the headache? More the forehead, more the back of the head?
Can vary.
Good. And do you have it more, say, if it hits the eye too?
Not usually.
Good. And one thing, looking at this is what I normally do too. I always point to the areas. Remember I don't know if you guys had your patients wear a mask or you wore a mask during COVID also. What happened? We lost that communication skill of our mouth. So what do we have to do? We had to adapt to that. I use my hands more now. I go, okay, was it here? Was it here? What was going on? So almost you get that extra communication so they get to see what's going on too. When you talk to a patient, do you sometimes repeat back to them what's going on with them also so they, again, understand that we can help them with? So was the pain, Steve, was it more up here toward the base of the neck or more the shoulders when you had the headache, the soreness?
More of the upper neck.
Okay. Was it from doing 500-pound squats or shrugs, or what were you doing? Just life?
Woke up with it.
Just living. Do you have kids?
2.
How old?
4 and 9.
Congratulations. I apologize. Young kids. They're pretty good? Yeah, so 4 is preschool still, correct? Or is that kindergarten?
Yeah, he's just in the language program. He's not. Kindergarten's next year.
Fantastic. And 9 is 3rd grade, 4th grade? 3rd. I'm 21 and over. Yeah. So I'm done with all that stuff. Yeah. Fun time. So have you had your neck adjusted recently?
A couple weeks ago.
Good. Do you ever get your neck adjusted seated?
I have.
Good.
Usually.
Is that okay for you?
Doesn't matter.
Perfect. Grab right in the middle here. So when I adjust someone, I'm always going to tell them what they're comfortable with, if they had it done before. And if you have someone as a new patient too, I always ask them, just to clear everything, have you been adjusted before? Why is that important? Allows you, I think, the clarity, they know what to expect. I think that helps a lot too, right? And you also know if you don't take x-rays in your office or don't sometimes have time for that, if they don't want x-rays, allows you to get that clarity too. It's a little bit safer for them. Okay, you do have no blood pressure issues, correct? Good. No previous traumas, accidents, run into a wall today? When you're walking here, you didn't run into a wall or anything? You didn't fall off a building? Then we're good to go. Okay, so I go right here. Everyone's technique different. The basic skull, I feel the occiput as you guys have in the past. I'm gonna go right here, Steve. How's that feel?
Okay.
Good. How about this side here?
Okay.
Good. This side for me feels a little tighter, so I'm gonna come right in here. When I adjust your neck and you hear sometimes a little bit of a pop, sometimes a loud pop, when you adjust someone for the first time, what's the 4 major reactions for their first adjustment? Whoa, exactly, right? Like, what the heck was that? Isn't it amazing? I always go when someone says, this is my first adjustment, I go, I'm excited for me and for you. Because I'm looking for, I go 4 reactions exactly. Are they going to laugh? Are they going to cry? Are they going to have Tourette's? Or are they going to speak some other language? You know? So you don't know. It's exciting. Okay? Let's go right here, Steve. Let's go on this side first, right there. Take a deep breath in. All the way out for me, bud. Just like that. Is that okay? Mm-hmm. Good. Okay. How many people here speak different languages? English, Spanish, all that stuff too. Why? And I don't speak Spanish. I speak Spanglish, but I communicate well with someone who speaks. I'll tell them, breathe in, breathe out, relax, left and right, things like that. So it allows them, again, that comfort level over time. So here too, let's get on that left side now. When I'm here on this side, what do most patients think I'm going to adjust? The left side or right side from this side? What do you think? Now, do you think I'm adjusting this side or exactly, right? You know, at the same time I'm on with them. So all I'm going to do is make sure I tell them I'm actually adjusting this side over here, Steve, not this side this time, okay? I'm going to go right here. Go right here. Turn your head a little bit more for me. Take a deep breath in, bud. All the way out. Just like that. Is that okay? Good. Do you have any shoulder issues?
Left shoulder.
Good. What's going on with your left shoulder, sir?
Been bothering me for a few months.
Good. What, as you guys are doing this too, what triggers that bothersomeness?
Sleeping, lifting weights, adjusting sometimes.
And then I get that sometimes on the left side too. And was your initial injury with that or just over time with work?
Just over time.
And what exercise really bothers or you limit your exercise? Anything you do?
Things over my head.
Okay. And how do you stretch your shoulder normally? What do you do?
Backwards.
You ever use a broomstick to stretch?
No, like this?
Yeah, what I do normally with my patients, I'd bring a broomstick, should have brought it. I take my broomstick, go right overhead, and all the way back. And keep the elbows straight at the same time, allows your body to really stretch those shoulders. I tore mine back in 2000, so I'd stretch every day. And so in part of practice too, as you know, how do we get our body warmed up every day too? That's part of it. So I'll adjust your right shoulder first to kind of show you what's going to happen with your left shoulder. So bring your right hand to your right ear just like that. Perfect. Bring your elbow in for me. And let's bring that, I'm going to go right here. Take a deep breath in. Breathe all the way out. And bring that shoulder. Does that feel okay? Did you feel that release right here?
A little bit, yeah.
Yep, right there. AC seems okay, so we'll do this too. Bring your hand up. And hand overhead. Let your hand relax for me. Take a deep breath in. Just a little bit of pressure right there. Just get a little pressure off that AC joint up here. All right? Other side now too. I'm going to test this side first, so bring your hand to your ear. Elbow in. Just a quick test first, just to stretch it. And where is it painful, sir? Back here or up top?
Here, and I'm not sure.
So let's try it one more time. Let's try it one more time. Good. Right here. Go. Where do you feel that?
Yeah, right here.
So bicipital
I've
tendon?
injured both of my AC joints before.
Okay.
Yeah, I feel like maybe there's AC and maybe a bicep tendon also.
When you, for example, just stick your hand out like this.
Different.
So bring your elbow straight. Resist by hand. Where do you feel that? Yeah, so bicipital tendon. When I tore my shoulder, same thing. Bicipital tendon, pec minor, anterior delt. So when I do this adjustment now, I'll do it real light. Here, bring your hand over your head again for me. And then all the way back. How does that feel?
It's a little painful right at the top there.
Yeah, so the AC joint too.
Ow.
Yeah, right there. And so I would do your stretching on this side, that broomstick stretch like this. And I'll give you one more to get my patients. So on your back for me, on your back. Take a weight. Patients start with a water bottle. With your left hand and arm, make a right angle with it.
Yes, sir.
Yep, and then bring that hand, water bottle here. Keep the elbow relaxed along with the shoulder, just like that. You've got to stretch, my friend. As you know, you're already strong enough. It's the flexibility we have to focus on. So that, let your shoulder relax, let the weight of the water bottle, a lightweight at home, can of soup, chicken soup, that's my favorite, chicken soup. And let that hand slowly rotate backwards, let it relax over time, maybe a 2-minute stretch. As you know already, Doc, it's that shoulder joint like the hip winds up like a piece of rope. Can we unwind it slowly? Because all the work we're doing all day long is push, push, push. Let's unwind an extension. At that point, let the side of a better couch, allow your hand to slowly come backwards. Just work. If you've been in practice long enough, we're all sore. We get beat up. Shoulder, back, hip, whatever it is too. All right? How's that feel?
It's a little painful.
Is it painful or uncomfortable?
I get down there, it's painful.
Okay. So only go where it's uncomfortable and then stop there. If it's something's painful when you stretch, what happens? Things guard and tighten. We want to avoid that if possible. We want to help our patients especially stay where it's uncomfortable. At that point, that over time will get a little bit easier, then make it go further back and further back. And I would just hold that stretch normally, doc, to make sure that ligament stretches. When I work with physical therapists and trainers, ligaments need that constant tension stretch. The muscles need the movement. So I'm focusing yours is more ligament in that area, in the AC joint area, even the humeral head too, to get that to slowly relax. Just hold that stretch. Just a light weight at home. We're all going to have something, my friend. Remember during COVID, all I had at home when the gyms closed during COVID, what happened? What did we have to do? We worked out at home, right? Or did something at home. All I had at home was my wife 5-pound pink weights. I go, okay, 60, 70. I'm like, it's not going to really be effective. So using our body weight and things like this, simple things, allows us to slowly get our body loosened up. Before I came today, like I do every day, 7 days a week, I stretch 15 minutes every day. 15 minutes stretch, enough steps where it hurts a little bit, and I do 2 minutes of planking. That's my routine so I can practice another 15, 20 years if I want to. But that point for yours, doc, is making sure you do that every day, and the broomstick every day. I keep a Swiffer in the pantry in the kitchen, and I sit there 5 in the morning, 5 at night. But if you have that routine, boom, that point will kind of help us all. How's the mid back? How's the low back?
Pretty okay. Low back sometimes gets sore, but.
Do you want the full adjustment today, sir? Good. Cross your arms for me. If a patient has a bad left shoulder, or not bad, just uncomfortable left shoulder, how do you set them up for the thoracic P to A adjustment? What do you guys normally do? How do you adjust their position to make sure you don't put pressure on that shoulder? What do you do?
I let them bring it up as high as they can.
Perfect. What I do also, doc, is I make sure I use that left or that opposite elbow that's not sore as my leverage also. So I'm going to have you do exactly. I'm going to have you go here. I'm going to switch here. So it tells me that top arm, even though it's high enough, that top elbow is my contact point from my hand here. I'm going to come around his back. I was born with long arms, even goofy as a kid. It helps me now as a chiropractor. All right, so I'm coming around your body, just like this. And then Steve, take a deep breath in, all the way out. Good right there. All the way out. One more time, sir. Is that okay? Mm-hmm. Good. No pressure on that left elbow or arm? Good. And one thing, too, as you guys already know, too, was if someone has a chronic shoulder problem, chronic hip problem, do you always tell them to communicate with them? It may affect your neck, also may affect your upper back. It's all connected, correct? So I call it a shoulder complex issue, not just a shoulder issue, if that's the issue. It just needs the stretching. That's all it is. Lower back-wise, do you guys do a leg length check with your patients? Easy, right? It's a quick boom, 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 especially if you know from the x-rays or previous treatment their legs are off, okay? So I just tell them, okay, right now here, you're good, my friend. Man, no problems on your lower back, good. So here, if someone does have a lower back where their hips are off a little bit, what I tell them is if my left leg is a little bit longer than my right, so I'm here, okay, I tell them, I'm gonna show you what that means to me. That means to me that right now, this hip is higher, my right is higher turning up, my left is turning down this way. When someone has sciatica and you do a leg length check, what happens 9 out of 10 times? Is which leg, if you do a leg length check with someone with sciatica problems or even antalgia too, what usually occurs? What's the link? Mine normally is if someone has sciatica left leg, and I do that leg check, it's going to be a longer left leg because it's more dropped on that side. That's what I normally see. When I have that, I'll adjust them based on that, and I'll just usually the higher side first to make those hips. I tell them, I'll show them this. Steve, what I'm going to do if you had a leg length issue, right now your back is doing this. I want to get things back to more level, more neutral to take that pressure off your lower back. That make sense? That's what we do. And a lot of when we communicate with visual, auditory, even touch and feel, allows them to understand it the way they want to understand it. Okay, does it make sense? If someone learns by speech only, easy. If someone learns by visual, easier. If someone learns by touch, work with what they work with. I think that's what it comes down to. So see, what I'm gonna have you do is lie on that side for me. Your back's good. Right here. And a little more toward me toward the end table. It's more of a massage table, so not a full adjustment table. And then bring that shoulder back more too for me. This one here, bring that shoulder back. There we go. What I do have patients do to make my job easy, I tell them, bring this foot down to the floor, sir, much as you can. Why does that help me? Because I'm not going to do this over here. I'm going to be able to go here, because Steve has an okay low back, and come straight down on his back instead of being leaned over. Right here. Not bad. One more time here. There you go. Good. Other side for me too. So it allows you want to make sure whatever you can do, save your body. Right here too. There you go, Steve. Is that okay with the shoulder?
Yeah.
Shoulder's good, good. Right here. Good with the leg drop. More of a hand drop here too. A little bit more, it's a little bit tighter side as you know, right here. There we go. Good. All right, my friend. Coming up. Shoulder stretch, buddy. You have a long career, young man. How old are you then, sir? You don't mind asking?
46.
Yeah, 46. I'm 50. It's different at 50, but enjoy your health. Have fun with your little ones, too. Any questions at all? Yep. When you adjust somebody, what do you say after you adjust them? Do you have a reflex that you say? When I adjust somebody, I go, good. That felt good. Great. Give them a little bit of a, that was what you were expecting. Even if it doesn't have to pop all the time, right? Can we go, that was good? At that point they go, all right, good. It allows them, that's just reading from my head, allows them to really know they know what you're doing is going to help them. So Doc, Tony, nice to meet you.
Nice to meet you.
What's your name?
Waiters.
Waitress, nice to meet you.
Nice to meet you.
So what's going on today?
Tightness
Neck and shoulders? Good, good.
and in my lower back.
Good deal. Any injuries in the past?
No, I just been traveling a lot.
Perfect. Where did you travel to?
Well, I was in England for 5 weeks.
Wow, that's awesome.
And then I just got back from Oakland yesterday, driving. So I'm just. You know.
I apologize. Drive's not fun. I'm not a long haul driver either.
Yeah.
Not fun. How's England?
It was great. I was running a practice over there for
What?
5 weeks. So.
That's awesome.
Yeah.
Anything they do differently over there than over here? Out of curiosity?
No, I'm a talker, so I like to explain everything.
Yes.
And the first year I went, because they have socialized medicine,
Yeah.
they like the fact that we explain everything because they don't get that. So,
Through their chiropractor or through the medical doctor or
well,
both?
If you need therapy, they'll say
Yeah.
go to the physiotherapist.
Yeah, physiotherapist, yeah.
Whereas I show them the exercises that they need to do. So they like that, so they have me come back again.
They save you save them time.
Yes, yes.
Why is communication so important for you? Or as a feedback from your patients?
Well, and this may sound kind of weird, but I've never considered myself to be a very, very smart person. Mm-hmm. So I've always felt like I had to really explain myself so that people would accept what I'm
Yes.
saying. So, and because I'm not a very, I would say I was not a very smart person.
In your own perception, got
In
it,
my
got
own
it.
perception, I always had to ask the teacher. Most teachers didn't like me because I would ask like 20 questions because I had to get it in my head to understand it. So I feel people have that same
Good.
view. So that's why I try to be so expressive to them to make sure, now do you really understand it? Did anything else you don't understand? Because that's me, okay?
And when I tell my patients when they ask a lot of questions, which I think is good, I tell them I like someone like that versus someone who is quiet because I don't know if they get it or not.
Yes.
When you ask questions, it helps me understand that you got it.
Yes.
So it reinforces that person who asked the questions, thank you for asking questions without telling them directly.
Yes.
Fantastic. And with what you did in England too, what was their feedback overall when you helped them after when they're leaving, when you helped them with their exercise, their stretching, their adjustments too?
The problem I had was really with the staff because it's more of a kickback office. I was so booked to where they start not booking patients because they said, Doc, we can't book anymore. So I said, well, let them come in on my lunch break.
Yeah.
And they're kind of
Wait a second.
they're kind of kicked back, so they started not scheduling patients. So I kind of noticing that, but the patients loved it.
Good.
They loved it, and I thought it would be a language barrier, and also I thought it would be by me being a black doctor, practicing in an upper middle class white area, I didn't know how they would perceive me.
You didn't know until this is last year or this year? Because you said one last year too,
Well,
right?
I did 2 years.
Okay, okay.
I did it this year. I just got back in February.
Yeah.
They loved it. I don't have a problem with color, but some people do. I've had patients walk in my office and see I'm black, and they'll say, "Oh," and I already know when they're not coming back, and they'll go, "Oh, I left my ID in the car."
Oh, I'll be right back. Never.
And so most of my patients are white and Spanish, and they ask me how I feel. I say, I don't care. If I can help somebody and their back hurting, and they don't want me to treat them because I'm black, that's their problem, not mine.
Good.
So I don't.
Isn't
I
it
don't
amazing
worry about
when we as doctors have no prejudice? Doesn't matter. They have a spine. They need their help.
it. No, yeah,
Doesn't
I
matter.
don't bother me.
No, it's when you come with that mindset too. You don't come in going, I expect this, this, and this. I just want to help people.
Yeah.
When they see your heart,
Yeah,
I think that's the
all
biggest
it's all
thing.
right. So it's no big deal.
The heart's the key.
I'm gonna tell, if you don't mind me sharing a funny story.
Yes, of course.
Okay.
Please do.
I was calling an insurance lady. When I call, I'm always very jovial with them.
Good.
And then I play smooth jazz in my office.
Awesome.
So when they call, they always love to take my call because they like to hear the music.
Yeah.
And so I had this one agent, and we were talking, and she said, Dr. Williams, don't worry, I'm going to send your check out. But she asked me a question. She said, I just want to ask you a question, Dr. Williams. Would you mind, would you make love to a white woman? Which I thought was a strange question.
Like, excuse me?
Right? So I told her this. I said, ma'am, are you white? Go, yeah. I said, do you know you've been making love to a black man all your life? And she said, how? I said, because when you cut the lights off, everything is black.
That's true.
Right? And
That's
so she
true.
starts laughing. And then all her people,
Coworker,
what's
yeah.
her name? They was like, can Dr. Williams, when he called, can we take his call? Can we take his call? And so, that's just how I try to practice. I just have fun,
When you have fun, does that reflect in your patients having fun too?
Oh, yeah. I've treated people for 30 years. I mean, I had patients who live in Oceanside, and they hated to go to a doctor that was close. And I'm driving back from Oakland. She said, Dr. I just had to call and just let you know how much I miss you. And I'm sorry I can't come up. And she was apologizing. I said, Julie, it's okay. I said, as long as you're getting chiropractic care.
Yeah.
And I treated her mother, her father, her husband, her brother, her brother-in-law, her sister-in-law, and her mother-in-law.
And a lot of it is when they get that personal, professional touch from you, they know that you're going to take care of them.
Yeah.
When your patients leave, they leave with a smile.
Oh, yeah, well, I hug all my patients when they come
Fantastic.
in and when they leave. So they know if they go to walk out, and I go, where you going?
What the heck?
And I say, your adjustment's going to fall apart.
Yeah.
And then they'll turn around and go, oh, I'm sorry, Dr. Williams, and they'll come and hug. So.
It's amazing when you have that openness, I think, with your patients. They don't get that from a medical doctor, from anybody else sometimes in their life. If you have people that don't have anyone in their life, say they're a widow or just a single person, maybe the only hug they get that week.
Yeah, I also send out birthday cards to my patients. And one patient called and cried. She cried. She says, my own husband don't even recognize me, and she cried. And she says, you're the only birthday card I got.
Wow.
I mean, that.
And do you do that because you want them to come in as a patient, or you do that for some other reason? I know why, but tell everybody else.
Well, number one, I don't know if anybody in here ever knew John Thie, Dr. John Thie and Leroy Perry. Probably the old timers would know John Thie. He was a Parker lecturer.
Okay.
And one of the things he taught was that you do personal things for patients. He said most doctors take the money, and they don't care about the patient. So ever since I've been in practice, I've always sent birthday cards, or if I know it's their anniversary, I'll send an anniversary, or I'll call them up and say happy anniversary. Some of them, I used to have a spa membership, which recently they moved.
Yeah.
I would select patients and give them a day at the spa. And they would appreciate it, or if they couldn't come in, I'd go to their house and treat them. And it's about, to me, I was a misused child. I was physically and mentally abused when I was a child. And so for me, I want people to treat me like I want to be treated. And so that's why I do what I do. Because I know if I was hurting and someone came to me, it would make me feel special. So I like making my patients feel special because of my background. Okay.
And you just have a big heart.
Yeah.
You know,
It's just,
everyone has something they've gone through, but when you have a big heart, I think allows you to reach out because it not only does it make them feel good, it makes you feel good too.
Oh yeah, oh yeah, oh yeah, and it's great. This guy here,
Huh?
he's real selfish.
I know
He
that
comes to
guy.
my office and get treated, but
I
he
know
never
that guy.
treats me, okay?
What the heck?
Ashton,
Oh, wow.
he
Wow.
told me you don't treat black people. He already told
Wow.
me that. You know, so. No, man, and we get along great. I want to make sure everybody understands that we get along great. Don't say, God, no.
Like, wow, that guy.
Eggs at
Hey,
you later. No,
hold on,
we
let me
get
find
along.
something I can throw at him. No. when you have, like I said, that's the biggest thing too. And I'm different, but I give everyone my cell phone number on the back of my card, and I try to call them every that same night or the next day.
Yes.
How are you? How are you doing?
Yes.
Come a family member. Here's my information. Call me. Update me tomorrow. How you're doing?
Yeah.
I don't have weekend hours, so I tell them yesterday. Hey, here's my information. Gave it to her son Abraham. Here's my information. Call me tomorrow with an update with how your mom's doing.
Yeah. Yeah,
When you
it makes a difference.
It's that personal touch because it makes you feel good. If it doesn't make you feel good, please don't do it.
Yeah.
But it's going to make you feel good too when you have that personal touch. You're helping someone, goodwill, karma, whatever you want to call it. And it comes back to you tenfold. Yeah, but you do it now because it helped them.
Yeah, and don't do it. I've learned that patients know if you're doing it just for the money. I had a situation when I got back on 5th of February when I walked in my office. My office has been flooded since February, so I haven't actually practiced in my office.
Got it.
But my patients have said, "Hey, Dr. Williams, I've been going to their house." You know, and I have, patients who actually own buildings. They said, "Dr. Williams, you can come over in my building and practice. You can do this, you can do that," because they realized that I went out of the way for them.
And they realize how much people you help. So if you can't help them in your office because it's flooded, physically flooded, at that point, can they give you opportunity to actually work with other, not only themselves, but also other people that you help too?
Yeah, I always say it's just nice to be nice. That's the bottom line.
Is it hard to be nice?
No,
No, it's not. It's simple.
it's easy.
It's easy.
It's easy to, one of my best patients, I'm also a minister, so
Good.
I was at church at Sunday, and they needed to be treated. So I treated him on Sunday, but I didn't charge him any different. And he says, look, I already have my own chiropractor. I've been there with this guy for 30 years. He said, I'm not going to leave, but I'm going to send you patients. I've treated his wife, his neighbors. He goes to his other chiropractor, but he sends all the patients to me until he eventually moved up north because he got, age and his children is taking care of him now. And I really took that as a compliment that he would do that.
Does he do it because you're the best adjuster in the world or because of something else?
He felt that I cared.
That's the
Because
key.
he said, if any other doctor would see me on Sunday, I told him, I said, look, I get out of church around 12:30, so I can see you around 1 or 1:30. And when he came in, I treated him, and he was expecting that it was going to cost him a lot. I said, no. I said, I just charge you the regular. And he said, really? And he went on and told his wife, he said, I want you to go to him. And she ended up having a herniated disc, and I was able to help her through that process, and his neighbors and things of that nature because of that.
Because you care, not because of anything else. That's all it comes down to.
Well, I love what I do.
Yes.
I've been doing this. I worked with Dr. Thea and Dr. Perry for 7 years, where I call them my chiropractic fathers because they taught me ethical chiropractic as opposed to money chiropractic, which is a difference. And then I've been doing this 40 years. So I've been in this business 47 years, and I love it.
Yes.
I love it. I don't see myself ever retiring. I threw a birthday party for my patients, and they came in, and it was a first-class affair, sit down. I did spoofs and the whole bit, and the patients loved it. So in 3 years, I'm gonna do the same thing again. We had a banquet, and it was great. It was a roast where I roasted them,
Nice.
and they roasted me.
Perfect.
And it was great, and they loved it. And they told me, they said, Doc, whenever you do a good, we want to come
Nice.
back, because I wanted to show them appreciation.
Yes.
He supported me for, like I said, 40 years.
It's a two-way street, right?
It's a two-way street.
Yeah.
It's a two-way street.
Before your practice was flooded, what's your favorite day of the week? I'll give you mine in a second. I want to hear yours first.
Mine's is Friday.
Why Friday?
Well, Friday, number one, I work half a day.
Okay.
Number two,
Good for you.
number two is I work Saturday and Sunday. unless
Me
it's
either.
emergency.
I used to, but no more.
But I call that my Funky Friday.
Why is that?
Okay? I grew up with Motown.
Got it.
And
Okay.
so when I go to work in the morning, I usually have my sunroof back, and I'm either playing my smooth jazz or I'm playing my Motown.
Nice.
So when I go in on Friday, I have both speakers, so I put my Motown on,
Perfect.
and I'm relaxed, and all my patients coming in, they like, oh man, I remember that song by the Temptations. I remember that. And so it's just like a big party on
Yes.
Friday. So
And
that's-
they expect that too,
yeah,
correct?
they expect that. And,
Yes.
they'll come in, and sometimes if I don't have it on, they go, hey, Doc,
What the heck? The speaker's broken?
Where's the spinners at?
Where-
Where's Teddy Pendergrass? And so, but it's upbeat.
Yes.
And so they like that, and they'll come in, and they'll go, oh, God, I remember I was with my dad, and we was doing this, and they'll reminisce. So that's why I like Friday. I call it my Funky Friday.
Yes.
Okay.
So you leave them with a good feeling for the weekend.
Oh, yeah. Oh,
Perfect.
Yeah. Oh, yeah. Oh, yeah, definitely.
Yeah, mine's Monday.
Okay.
I go back to seeing my patients again, get back to normal routine, see who I need help next.
Right.
Just different.
Yeah. Oh, I'm jamming
Yeah.
every day I go to
Yeah,
work.
yeah.
I see people
Like,
women
boom.
putting their eyelashes on and stuff, and here I come in my car, my sunroof down, and I'm jamming, and they looking at me like, this guy's nuts. He's
Yes.
going to work, I'm
Course.
just jamming, I got my music, I get in, I cut my music on,
Yes.
smooth jazz, and I don't know if any of you know Eclipse. When I call them for help,
Yeah.
I have one lady I call my girlfriend.
Okay.
And if she don't hear the music, she said, I know this is not Dr. Williams. I go, why? She said, I don't hear my music. So I have to cut the music on, and then she said, okay, now I feel better.
The
I feel
link.
better. Yeah, it's that link.
The link.
It's
Good
about feeling
music,
good.
relaxing, happy. That point, your patients come in expecting that. They want to leave happy.
Yeah. Yeah.
Huge links. Excuse me. But that's I think part of it, as you guys have heard and done your own practice too, when you have that connection, again, hearing, visual, auditory, that mood, that feeling from all those things you can do in your office allows you to get a patient coming in the door that wants your help.
Yeah. Well, when I do my consultation with patients, I always tell them there's two things that has to be.
Good.
I says, number one, I say, I want you to feel good about me.
Perfect.
And I says, the other thing is, I have to feel good about you. And I actually had to dismiss a couple of patients because the way they were talking to me, they talked to me just because they were paying me, that they owned me. So I told them, I said, ma'am, I told you when you came in,
Yeah.
it was a two-way street.
Yeah.
I said, I no longer like you.
Yeah.
I said, so it's
Not
better that you
personal.
go- I said, it's not personal. I said, you have to go someplace
Yeah.
else. And I just let them know. I mean, I'm not going to play games with them. I don't want to play
We've
games
been in
with
practice long enough, Dr. Williams, that we don't want to deal with that
me.
stuff. We'll call it stuff.
You know,
Because what does that stuff do to your office? What is it? Who they bring in also too?
well, I don't want that.
Yes.
I don't have time.
We want a clean, happy, healthy office.
No, I just won't deal with it. I mean, I'm 67 years old. I don't know how much longer I'm gonna live. You think I'm gonna be
30
dealing
years,
with,
my friend.
You think
I'm
I'm gonna
30
be dealing
years.
with somebody that's
No.
bringing trauma in my life? My wife passed away in 2012, and it's really interesting. I'll go out on a date with a lady, and after the first date, I'll tell her I don't think we're compatible. 'Cause
Perfect.
She's got all these issues.
Yeah.
I said I don't have time to deal with issues. Go to a psychiatrist. Go see Dr. Phil. I just
Yeah.
don't have time for it.
Yeah.
I just don't.
Well, when someone comes to your office at that type of mood or a date too or whatever it is, when they have that first impression, is it gonna get better or worse?
Worse.
Worse. You only get the first impression. You only get one chance. You want to give your best first impression on your first date. If that's the best, they're like, it's only gonna go downhill. You're not gonna save someone mentally, right?
Yeah.
Okay. I give her my card with my number on there. I had one lady. I don't want to say her name. She would call me, leaving 10-minute messages. Oh, today I did this. I'm like, no, that's not what it's for. I'm not your personal free psychologist, but you want to give that people an opportunity to tell their real story.
Yeah.
So when you open your heart up, allows them to hopefully do the same thing, to realize, hey, I'm here for you, but don't abuse it either.
Yeah. Well, when people call my office, my message, if you call my cell phone and to say, hello, it's a great day. You're a very special person. You reached the voicemail of
yeah.
Dr. Williams. I'm not available to take your call. Please leave your name, area code, phone number.
Of course.
And remember this, you are a very special person. So leave that on the message. And when I talk to people, that's what I do.
When you have that
Set
mindset,
that pace up front.
boom, done. At that point, you understand that this is what you expect, along with helping someone else.
Yeah.
You know, if someone calls and goes, I'm upset because you left at 6:05, or you left at 6 and I showed up at 6:05, you didn't take me as a patient. Yeah, because already my car was leaving. You know, you just need those headaches for one, too. Let's get you adjusted. I know we're getting short on time to get set up over there, too. So neck, little tight, little sore.
Yeah, right.
How do you get adjusted normally, Dr. Williams? What do you normally do?
Well, whenever.
He wants to
friend.
adjust you.
Adjust
Your
me.
quote unquote friend.
Yeah. Whatever my friend adjusts me, you know. you tell him, Doc. You adjust me.
Yeah, full body, diversified, boom.
Yeah.
Take care of him. Got it. All the way up from front. Got it. I'll take it. I'll take his head off a little. Nah, he's good. Good for you. So you love being in practice, correct?
Love it.
Remember, you're back in school. Remember people in the class, because you're in class with people for, what is it, like 3.5 years? I went to LACC, called someone else now too, on your back, Doc. A lot of it was, you went to people that went over just for the money, right? You meet people, everyone's like, you get classmates like it all the time. Are those people, there you go, a little higher, there you go. Are those people you think, this is, say even 5 years after practice, they came in just for the money, but that PI clinic, or I had someone last time, their work comp clinic had to take a dump, they had something happen to them, would they still practice like Dr. Williams if they came in with that type of a heart? No. So when you're in practice long enough, it becomes about this, helping your patients, caring for your patients, making that your priority, not about the dollar bill. I think when you practice long enough, that's the key. I'll check your neck one more time, Dr. Williams, since your buddy over there doesn't check you very often. Sure, we're double checked. Right here. Double check this side. Good, clear here. Any shoulder issues, sir?
I think right through here. I think I get the trap in the shoulder.
I'll check the shoulders afterwards. I'm going to adjust you this way first for your thoracic. Bring your right hand over your left. There we go, and hand here too. What I do too, and you guys probably do the same thing, when I'm contacting for the mid back or low back, I always put my knee on the table. What does that do by putting your knee on the table? How does that help you physically? If I'm like this, adjusting somebody, where's all the pressure? If I'm like this, all the pressure's on my leg, my back is safe. So when you practice for a long, long time, you learn how to adapt your body to make sure you save yourself, not just the patient. Let's go right here too. Deep breath in, Doc. All the way out. Deep breath in. All the way out. One more time here. All the way out, sir. Good. And right now here too, lower body. Leg length check for you. Higher here, lower here, just a little bit, not by much. So right now, as you can see, a little bit lower here, a little higher here. So I'm going to have you do is go on your side facing your left, your right side this way for me first. There you go, Doc. Sorry, head pace doesn't move very much. Where's your practice?
St. Denis.
Oh, you're real close then. Leg drop to the floor for me all the way. Then arm back up here. There we go. Right there. Perfect. I'm good with that leg dropping. Deep breath in. All the way out. Good. So unless you need to, can you use sometimes your hand, but sometimes your elbow and forearm too? Other side for me too. We adjust a lot of people all day long. I think you got to work tomorrow too, right? Right here. Now I'm doing more hand contact on your sacrum SI right there. Doc, take a deep breath in. All the way out. Right here. Good, right there. There we go. Coming up. Check your shoulders too. So right now, let's do a quick check. Let's do the right one first. Hand over top. How does that feel?
A little tight.
A little tight.
Not hurting.
Good. Bring your elbow in a little bit. Take a deep breath in. All the way out. Good, right there. Other side for me too. Arm up first. Is that tight?
Yeah, that one's more tighter.
More in the AC or more to the back?
More.
Back there, right? Good. So I'm okay with that one. Take a deep breath in. All the way out. Good, right there.